Hey guys, Doc Heps here. So you notice that there's this weird thing on or in your scrotum. It feels like a little pebble, a cyst. What the heck is this? Stay tuned and I'll give you what I think might be going on. Hey guys, it's Doc Heps. So you were doing an exam and you noticed this cyst on the skin of your scrotum or maybe deeper in the scrotum by the testicle, and you're wondering, what the heck is this? You're kind of freaking out. Well, I'll give you some insight as to what it might be. Stay tuned to the end and I'll tell you my tips and tricks for how to approach this. What's the next step? Thanks for watching. So a scrotal cyst, what's this all about? You did an exam and you're wondering, what does this thing that I'm feeling represent? Is this dangerous? Is this not? Well, as a urologist, we see a lot of this, and I want to reassure you that cysts on the scrotum, whether they're on the skin or deeper, are very common. The vast majority of time, 98% of the time, they're benign, meaning non-cancerous, non-malignant. There's just a whole slew of things out there that can arise on the skin or deeper in the scrotum beside the testicle that can be just typical cysts or small growths that are not cancerous. That's number one. That being said, you need to get checked out. If you feel something that's growing and is not normal to you, it's easy enough to see your primary care or make an appointment with your urologist. We'll be able to get an ultrasound of the testicle and scrotum if necessary and do an exam to help guide you as to the next step. So what could it be? What are the common things that men may feel on their scrotum? Well, number one, cysts. If they're on the skin, there are many different types of skin conditions that can form cysts. Some of these are called sebaceous cysts. These are just small fluid-filled sacs. Oftentimes, they can be filled with white fluid or milky-colored fluid. Sometimes these cysts are hard and sometimes they're soft. Sometimes they can grow and become irritated. They can become infected and get red around the skin and become painful. Oftentimes, if there's no evidence for infection, we just leave them alone. If they start growing and get bigger, then there are surgical options for these scrotal cysts to be removed. Now, if you feel something inside the scrotum, then most commonly you'll need an exam to better understand what's going on. There are a lot of different structures on the scrotum. There's blood vessels, there's fatty tissue, there's muscles, there's a structure called the epididymis that is adjacent to the testicle that helps the sperm learn to swim. And oftentimes these structures can form cysts. If it's on the epididymis, sometimes these cysts or sac can fill with sperm, and we call it a spermatocele. If it's just filled with body fluid, then we call it an epididymal cyst. Sometimes these vascular structures can form a little calcification, and these feel like little tiny pebbles or BBs in the scrotum. There is a harder structure within the scrotum called the Vas Deferens, and that's a normal tube that carries the sperm from the testicle to the prostate. But if there's any suggestion of a hard lump or mass that's near or within the testicle, you need to get it checked out. Another thing that can occur that's separate from these cysts are little vascular or red spots that occur on the skin of the scrotum. These are often called Angiokeratoma, fancy terms for little vascular or abnormal blood vessels that form on the scrotum that sometimes, if they get scratched, can bleed pretty significantly. So these can be tiny, ranging from just a millimeter or two in size to a little bit larger. And some men don't even know they have them, they never cause problems. Overall, scrotal cysts are most commonly benign, non-cancerous conditions. They're oftentimes just hard lumps on the skin or little vascular malformations that cause a nuisance. Typically, we don't do anything with those skin conditions other than reassure you. If they are causing trouble or problems, infection, sometimes we would treat them with surgical intervention or remove them, cut them out, or cauterize those vascular areas. If there's a cyst or some sort of area that feels abnormal deeper in the scrotum next to the testicle, oftentimes an exam will tell us, hey, this is just a benign cyst on the epididymis, like an epididymal cyst or a spermatocele, or we call it a little calcification. But if there's anything that's more suspicious within the testicle or there's a hard lump on the testicle, then we definitely need to get an ultrasound to rule out cancer. So if there's any questions, don't hesitate. Go to see your primary care or go to see your urologist. We'll definitely help guide you as to what's going on. This is Doc Heps. Thanks for watching. Appreciate your time. Make sure you subscribe to our channel and check out our other videos. Thanks again.